So your child's been diagnosed with croup. Here's what you need to know and a bit of what you might like to know. So croup is characterized by a barky cough and a fever. You probably already know that by now. It usually lasts 5 to 7 days, and the cough is worse at nighttime, usually the worst on the second night, and after that it gets progressively better. Now, if you're seen in the emergency department, we may have given you a prescription for a single dose of a steroid medication, usually prednisolone or dexamethasone, or perhaps we just gave it to your child in the emergency department. If that's the case, croup is likely to get much better more quickly. In the meantime, however, you can keep your child well hydrated. That's important. You want to give them Pedialyte if you have it. It's got the best balance of electrolytes, or water is just fine. Flat ginger ale, just something to keep them well hydrated. And keep an eye on their hydration status. You can do that by monitoring the amount of urine output they have, so the number of wet diapers they make if they're still in diapers, or the amount they're going to the washroom to produce urine. You can also look at their eyes when they cry to see if they're producing tears. Children who are dry often don't produce any tears, and you can look at their mouth to see it's nice and moist. And that's how you monitor their hydration status. So hydration status is one thing you can do. The other thing you can do is if they have a fever, give them something for it, either acetaminophen, which is the same thing as Tylenol, or ibuprofen, which is the same thing as Motrin or Advil. You can use the regular stuff, the generic. You don't have to use the brand name. It's the exact same thing. It's also nice to see once you give your child that medication, they return to themselves. Once that bothersome fever is gone, they look like themselves. And we as medical professionals use that as well to tell us how sick the child is. If you find after an hour later, after giving the medication, that it hasn't worked, say you gave acetaminophen, you can always switch to the other medication, the ibuprofen. You don't want to double up on the same medication, but you can try the other one if one hasn't worked. That's perfectly safe. Do keep in mind, however, though, you are just covering up the fever. They're still sick. They may be acting like themselves for the next 6 hours while the acetaminophen's working, but they're still contagious, so keep them away from other children. If you've had croup once, you're likely to get it again. And if that happens, here's a few non-scientific tips that you can try. One of them is to use steam, cool mist, and put a humidifier in your child's room. Alternatively, you can open up the window a little bit and let in some cool night air. Another option is just to wrap up your child in a nice warm blanket and take them outside. Many parents find that by the time they get to the emergency department, the cool night air has made the croup significantly better. Now, I've actually tried all those things with my child when he had croup, and none of them worked, but they're free. Why not? You may as well try them if it happens again. Reasons to return to the emergency room include, number one, poor hydration. So you're keeping an eye on the number of wet diapers, the amount of urine your child is making, if they're making tears. If they're very dry, they cry and they don't make tears, they're decreasing their urine output, then you need to bring them back to the emergency department, potentially for IV fluids. Second one would be lethargy. Now, lethargy for a medical person doesn't mean that your child is tired and not acting themselves. Of course they're not. They're sick. For us, it means a child who doesn't respond properly. So this is the child we put an IV in, a needle, and they don't even respond to that. So when you're looking at your child, talking to your child, and they're not looking at you, making eye contact, that's a lethargic child, and you need to bring them back to the emergency room. Lastly is a high-pitched breathing sound. So even when they're sitting still, they're not running around, they make this high-pitched breathing sound. That's called stridor, and that's quite serious, and you need to bring the child back to the emergency department for that. I'm Dr. Atzema, and those are my discharge instructions for croup.